వచ్చిందా? Hello, good afternoon. Today's topic is complications of scaphoid fractures. Last time we discussed about scaphoid fractures, but scaphoid is a very small bone with lots and lots of complications. So it is worth knowing about scaphoid complications. So what are the main complications of scaphoid fractures? One is delayed union, non-union, malunion, avascular necrosis, arthritis, and scaphoid non-union advanced collapse. So what happens in this advanced collapse? There will be arthritis in the wrist, and then scaphoid completely collapses, leading to the proximal row collapse. So delayed union. What are the causes of delayed union? One of the most common causes is that not diagnosing it in immediately post trauma. So on initial X-rays, it is not visible. So by the time the fracture is visible on X-ray, it will be always almost 6 weeks. So not using advanced technology in diagnosing this fracture is one of the reasons for non-union. One is inadequate mobilization. So sometimes when you apply a plaster, you don't immobilize the thumb. So you are not immobilizing it properly. And also fracture characteristics. When you take the fracture characteristics, proximal pole fractures are prone for non-union and delayed union. So other factors include displacement of the fracture fragment, instability, and also comminuted fractures. So non-union, why the non-union it happens? Because non-union is most common in scaphoid fractures because there is only one artery supplying it from distal to the proximal pole. So whenever there is a fracture in the scaphoid fracture, and when the fracture is more proximal, the chance of non-union are very high. So when the fracture gets when there is a fracture in the scaphoid, there is no blood supply from proximal pole to the distal pole to the proximal pole, which leads to the non-union. So this scaphoid gets only single artery, that is from the radial artery, and that is also a recurrent artery only. So because of this injury to the artery, most of the times scaphoid non-union occurs. That is because of poor blood supply to the scaphoid. One of the reasons, most common reason. Malunion. Malunion, when you miss a fracture and when you treat a fracture, but there is a comminution. So that leads to the malunion of the fracture with angulation, that is called humpback deformity. So how to diagnose this deformity? So you have to take the measure the length of the scaphoid and also angle. So height and length ratio is calculated. Basing on that, you decide whether the scaphoid is deformed or not. So other way of calculating is intrascaphoid angle. Whenever there is an intrascaphoid angle is more than 30 degrees, it is more. It is diagnostic that there is a malunion in the scaphoid. Avascular necrosis. So avascular necrosis is very common in scaphoid after trauma, but there is also another disease called Pearson disease where there is a loss of blood supply to the scaphoid leading to the non-union. So we already discussed that there is only one artery coming from the radial artery, which gives blood supply from distal pole to the proximal pole. Whenever there is a fracture in the scaphoid at the waist or more proximal, blood supply is violated to the scaphoid and it goes into the non-union. And avascular necrosis. So avascular necrosis is mainly diagnosed on MRI, where you see this is on T2, T1 weighted images, there is darkness, there is no fluid here, and there is on CT scan, there is cystic changes, and also when there is a fracture, you see that non-union of the fracture with combination of the fracture site. Scaphoid non-union advanced collapse. It has four stages. One is only in stage one, there is mild arthritis, there is non-union. In stage two, there is scapho-radiate arthritis. In stage three, there is scapho-radiate and capitate arthritis. And also in stage four, there is scapho-radiate and also scapholunate dissociation, leading to the instability of the wrist. So arthritis. Next, after all these things, if they are not diagnosed and treated, the end stage where it goes into the arthritis only. So it develops very severe arthritis, leading to the loss of wrist movements and function. Grip strength is lost. So management. When it comes to the treatment of the scaphoid fractures, there is one point is non-union without arthritis. You treat it in a differently, a non-union with arthritis and presence of AVN. So when there is non-union without arthritis, you go for vascular grafting or bone grafting. Simple bone grafting you can do, it will heal. Or you can also take vascular pedicle bone grafting from distal radius and then do grafting to the vascular grafting to the scaphoid. So that will help in union of the scaphoid, and also it is fixed with screws. But when there is when there is arthritis, you have to decide how severe is the arthritis. If it is arthritis is severe, you have to do scaphoid proximal pole scaphoidectomy, and you do perilunate fusion, intercarpal fusion, like scaphoid to the scaphoid is fused with the trapezoid and capitate bone. So that will give some stability to the wrist. For malunions, the best way is to treat is do an osteotomy for the malunion, correct it, and then put a iliac crest graft so that the angle of the humpback deformity is corrected. In scapholunate advanced collapse, we have to go for a proximal scaphoidectomy. Sometimes we do even styloidectomy, and we also do intercarpal fusion. Either it is limited fusion or total carpal fusion, leading to the stability of the wrist, and that will give some pain relief. But when there is severe arthritis, what you can do is only wrist fusion is the only option to do. Thank you.